Today we are talking about the secret to your back and hip pain that your doctor is missing.
This is a huge one, ladies. This is something we spend so much time talking to all of the women that we work with about. This is the connection point. This is what we talked about yesterday about connecting the dots and actually solving the problem instead of putting Band-Aid after Band-Aid over microscopic little issues.
Yeah, stopping treating just the symptoms, which sometimes come in the form of a diagnosis, and really addressing the root causes of many of these discomforts that so many of the women that we treat are dealing with.
And maybe it comes, like Jen said, in the form of a diagnosis. Maybe you went to your doctor and you've been diagnosed with hip bursitis, sciatica, piriformis syndrome, maybe IT band syndrome. Maybe you don't actually have a diagnosis. Maybe you just noticed your back has felt compressed ever since your kids are born. Or you tried to do, or your hip flexors, always with the over tight hip flexors. And the girls are like, oh my gosh, I have rolled it. I've stretched it. It is not loosening up.
I can't sit on the floor and play with my kids. I can't sit crisscross applesauce, or putting my kids into the car is super difficult. And
or you've tried the exercises you used to love and they don't agree with your body anymore. And you are so frustrated. Maybe you've tried a few other things, switched different methods, different programs, but maybe it feels better for a while, but then eventually something starts hurting again and you're in search of another method again.
And you've gone to the doctor. Maybe you have gone to the doctor and had a diagnosis, or gone because of pain, got imaging, and we're told, okay, there's like maybe some fluid loss in your discs, or, you know, a little bit of this or that, but nothing that we really see that's screaming that something's wrong.
Your x-rays really look fine. And these women come to us and they're going, please tell me, my best friend said that this was the place to go and that you have the answer. Please explain all this to me. Okay, we've got your answer. Nobody is taking a step back and pulling back that viewfinder for you and connecting all of this stuff when really it is absolutely connected. The good news about that is that it can all be dealt with and addressed with one solution. Should we go into a little anatomy lesson, Barney?
Let's do it.
We're going to give you a brief tour of the pelvis so that you can understand what we mean about it's all connected. Okay, so this is one of my favorite pictures from my anatomy book. As you can see, you're looking from the front, and this is the female pelvis. You can really orient yourself of where all these structures are. This is where you put your hands on your hips, is right at this crest of the pelvis here. Here in the back is your triangle-shaped tailbone. These are your hip sockets, all built into this one, basically, circle of bones. And then all the muscles that need to work together to keep all of this area feeling good cross over and through and around all of this. Their hip flexors come down from the low back and come right into the groin here. You've got the pelvic floor is that sling of muscles right underneath that hold all your guts in. You've got your deep abdominals coming across here and joining in the front, at the front of your abdomen. The top layer of abs, your six-pack abs, come and connect on the pubic joint here. All these hip rotators, absolutely, which love to do the job for your pelvic floor when it's not working, are all around here connecting in here, and they actually attach to the same ring of tendon that your pelvic floor muscles attached to. The other thing is your glutes. So that would be then the back. It's kind of hard to point to. Obviously on the side of the hips here, and then in the back are all your glute muscles and your low back muscles in the back up here. Point is, all of this stuff connects in, around, and through the whole pelvis and hip and low back structure. And in order to get rid of all of these issues all at once, what needs to happen is a rebalancing and a retraining of all of those muscles to work together for you. And they need to work together for you without having to think about any of them, which is why we steer far away from Kegels. Because if you have to think about any of these muscles firing for you, they're not going to work, and you're going to be back to square one with discomforts again.
Well, as well as, you know, Christina makes a good valid point of, do we train any other muscle group without movement? No, we don't. Your pelvic floor is not a magical unicorn. I always say that. It needs to be trained functionally with movement the same way that these other muscle groups do. So the secret is really not a secret. The secret is that you do have to address all of these things at the same time, which is what we do in our signature program. Because much of the method hopping and different aches and pains that may come and go are due to the muscular imbalances that have occurred. So a great example is during pregnancy, the abdominal muscles separate to accommodate for your expanding belly.
And stretch to oblivion.
Right? You have your glutes kick off towards the end of pregnancy.
That's
so
where mom butt comes from.
a lot of this stuff needs to be rebooted post-pregnancy. And if you're not doing the right things to reboot those muscles, they stay dormant.
Yep. They're happy to stay turned off. I totally had the flat butt problem after my first was born, so I know what it feels like. It doesn't feel good. It doesn't look good. All of this stuff has to be addressed to perky your booty, to flatten your belly, and to get rid of all these recurring little issues that get treated as separate problems when really they just can be fixed by rebalancing all the muscle firing to work for you to stabilize you at your center of gravity again. That's going to address the pee and poo issues too, if we haven't quite said that directly. All of this is roped into one picture and can be addressed at one time through movement.
And the way that I like to help women identify whether or not their body is functioning as it should is, if you cough right now, cough a couple times, you should be able to feel that your deep abdominals and pelvic bowl work together. These muscles should be firing as a team to support you. So if the pelvic bowl isn't firing, you may or may not have bowel and bladder issues. You may or may not have low back pain. You may or may not have hip pain, right? It presents differently for each person depending upon the birth that you had, the injuries that you had pre and post birth, and what you're doing on the daily. What tasks do your life require you to do?
Yep. And your doctors have your best interests at heart. Your therapists have your best interests at heart. The reason they're not doing it this way is because they haven't been exposed to this approach. It's not that they don't want to help you. They're using the tools that they've been trained to use. What we're saying is, if you step back and view it as a whole picture instead of microscopic little issues, you can actually get a lot more bang for your buck, retraining everything at once and knocking it all out by getting to the root cause, just reprogramming all the muscles to support you together again through movement and without having to think about them.
Love it. Well said. And look, everybody has to have their own journey. So if you are frustrated because you have been to doctors, you have had imaging, and you just feel like you're on this hamster wheel of it gets better, and then you feel like as soon as you do one thing, it gets worse, or maybe you're that person that you just keep boxing yourself in terms of what you feel you can or you can't do, or maybe you're like me post my third pregnancy, I could not hold my baby, and that still makes me emotional because of the back pain that I had with the DR and the prolapse and all the things that I was still trying to figure out at that time. So, if this is impacting your quality of life, you've seen specialists, you know intuitively that there's something going on that you haven't been able to put your finger on.
Every woman who works with us has that piece of the story. I've known something wasn't right. I've been looking for the real answer. I haven't been able to connect to my core. I haven't felt right in my body since then. Sometimes I even have a hard time describing it past that. But it always comes back to the same root cause of rebalancing.
And rebalancing meaning it's not just a pelvic bowl issue.
And it's not just a low back issue.
Yeah.
And it's not just a hip issue.
It's all the things. It's addressing pelvic floor, deep abdominals, back extensors, hip rotators. All of those things need to come to the party, as I say, at the same time with the same strength. So it's rebalancing the strength. It's waking those muscles up so that you don't have to think about it when you go to move and do all of the things. Those muscles are going to come back on board and support you in pain-free movement.
It's possible, and it starts to change in just a few tries. It's absolutely amazing to see the light bulb moments. And the other piece that we offer that is imperative for this to work is you start with learning how to feel better now.
Yes.
We teach you tools to feel better now from any and all of these issues to start controlling the discomforts, and that enables you to then build the strength smoothly in a bit of a dance between discomfort and strength. And you cross a threshold of, now I have the strength to not need those tools as much. and you start to feel so free, and the emotional weight that is lifted of feeling like you have yourself back.
Empowered.
It is amazing. We've been on the journey ourselves. That's why we get so excited about this stuff. And we love nothing more than to walk women through this path and see that change happen for them that they've been after and they've known that they could find. Please ask us all your questions, any hard questions. We've either lived it or we've worked with someone who has, and we'll answer any questions we can.
And we do one-on-one consults in the program. We do discuss when it is appropriate to get a referral to another practitioner. Who is the practitioner that you should see?
For what issues? Yep.
Yeah, it is a dance. You know, it is not a straight line in terms of, you know, magically everything goes away overnight, but it is doable, and we want that for each of you. So please reach out with any questions. We are happy to answer them.